Today we are going to discuss about the topic planning. Planning definition. Planning is a systematic approach to defining the problem, setting priorities, developing specific goals and objectives, and determining alternative strategies and methods of implementation. E.C. Banfield defines a planning as it is a decision about a course of action. Next, health planning definition. The orderly process of defining the community health problems, identifying unmet needs and surveying process to meet them, establishing priority goals, projecting administrative action to accomplish the purpose of the post program. Planning results in the formation of a plan. A plan is a blueprint for taking action, consists of 5 major elements: objectives, policies, programs, schedules, and budget. In plan, they have objectives, policies, program, schedule, and budget. In policies are the guiding principles stated as an expectation, not as commandment. Program is a sequence of activities designed to implement policies and accomplish objectives. Schedule is a time sequence for the work to be done. Next, coming to purpose of planning. To meet the health needs and demands of the people, health needs it have been defined as deficiencies in health that call for preventive, curative, control or eradication measures to match the limited resources with many problems, to eliminate wasteful expenditure or duplication of expenditure, develop the best course of action to accomplish a defined objective. Uses of planning. To match the limited resources with many problems, to eliminate wasteful expenditure, it enables priorities to be set, it identifies where resources can be directed, have the greatest impact, develop the best course of action to accomplish a defined objective. This is the health planning cycle. This analysis of health situation. Then we have to set objective and goals, then assessment of resources, priorities, then formulating a plan, then programming and implementation, then monitoring and evaluation. Types of health planning as outlined by Spiegel and Associates: problem solving planning, program planning, coordination of efforts and activities planning, planning for the allocation of resources. Problem solving planning. It involves identification and resolution of a problem. Example, if there is a problem of dental fluorosis in a community, a plan formulated to solve this problem is called problem solving planning. Program planning. It entails designing a course of action for circumscribed health problem. Example, planning a school-based fluoride rinse program for reducing the prevalence of dental caries in a community. Next, coordination of efforts and activities planning. It aims to increase the availability, efficiency, productivity, effectiveness, and other aspects of activities and program. Example, closing of obstetric and pediatric wards in hospitals located in areas with declining birth rate. Next, planning for the allocation of resources. It involves selecting the best alternative to achieve a desired goal when the amount of resources is limited. Example, planning to effectively utilize limited resources by replacing fluoride mouth rinse programs with sealant programs in areas high prevalence of pits and fissure caries. Steps in planning process. First, identify the problem. Then we have to conduct a need assessment and collect the data and analyze the data. Then we have to determine priorities, then develop program goals, objectives and activities. Then we have to identify available resources, identify constraints and identify alternative strategies. Then we have to given the resources and the constraints, choose those activities that will be most effective. Then develop implementation strategy, implement, monitor, evaluate and and revise. Next, ongoing. This is the ongoing phase. Next, identify the problem. It includes conducting a need assessment and analysis of data. Conducting a need assessment. The reasons for conducting a need assessment are to ascertain the cause of the problem, to identify the extent and severity of a problem, to evaluate effectiveness of a program. Other options for conducting need assessment: coordinate with research activities of other health agencies to investigate the past surveys done. Analysis of the data. Once the data is obtained from the needs assessment, the information must be analyzed so priorities are determined. Determining priorities. Priority determination is a method of using people's value and judgment of what is important on raw data. It is used to rank the problems according to the severity and helps to utilize resources tactically. If priorities are not determined, then program it may not serve the people in need. Then development goals, objectives, and activities. Program goals are broad statements on the overall purpose of a program, meet a defined problem. Program objectives are more specific and describe in a measurable way the desired end result of program activities. An objective is usually described in terms of what is to be done attained, the extent to which it is to be attained, um, who, population or section of the environment involved, where the geographic area in which the proposed program will operate, then the length of time required for attaining the goal, then types of objective, outcome objective and process objective. Outcome objective, it provides a means by which to measure quantitatively the outcome of the specific objective. Process objective, it states a specific process by which a public health problem can be reduced and prevented. Next, goals and objectives. Goals includes broad statement, remain stable over the course of the project, identify the long-range purpose of the project. Objectives, they are specific, limited in scope, changes needs of the population, identifies a measurable outcome of the project. Resource identification implies manpower, money, material, skills, knowledge, and technique needed are available for implementation of the program. Balance has to struck with what is required and what is available. Criteria used to determine what resources should be used are appropriateness, adequacy, effectiveness, and efficiency. It's the resource identification sheet. In resource, personal sponsors or supporters, they were public health organizations, professional dental organizations, dental and dental hygiene schools, industry, health consumer groups, government, labor, media, business, foundation, public schools. Then the clinical providers, there will be a dentist, dental hygienist, dental assistants, public health nurses, physicians, nutritionists, social workers. Non-clinical providers, planning, health planning agencies, clerical volunteers, students, parents, and retirees. For educational, professional organization, university students, analytical universities, consulting firms, equipment, dental units and instruments, dental supply companies, dental and dental hygiene schools, renovated public health clinics, hospitals, federal government depositories, computers, calculators, filing cabinets, business, industries, civic groups, hospitals, supplies, office supplies, and the consumer groups, industry, business, and government, dental suppliers, dental supply companies, dental product companies. Dental health education deals American Dental Association, professional organization, public health agencies, dairy councils, local, state, or federal agencies, National Institute for Dental Research, Center for Disease Control and Prevention. Facilities, hospitals, health centers, nursing homes, public schools, dental schools, public health clinics, industries, health maintenance organizations. The next, identify the constraints, roadblocks, or obstacles. Identification of constraints early in the planning stage can modify design of the program, create a more practical and realistic plan. Constraints, it may be as a result of organizational policies, source limitations, characteristics of the community such as lack of funding, labor shortages, restrictive governmental policies, inadequate transportation system, negative attitudes. Identifying alternative strategies, presence of existing constraints and available resources. Planners should consider alternative strategies, help achieve objectives. Sufficient number of alternative plans should be at hand. Develop implementation strategy. An implementation strategy for each activity is complete. The following questions are answered. Why? The effect of the objective to be achieved. What? The activities required to achieve the objective. Individuals responsible for each activity, when, chronological sequence of activities, how, details, methods, technique used, how much, a cost, estimate of materials and time. To develop an implementation strategy, planner must know what specific activity he or she wants to do. The most effective method for backwards to identify the events that must occur prior to initiating the activity. Implementation, the process of putting the plan into operation is referred to as implementation. The implementation process involves individuals, organizations, and the community. Only through teamwork between the individual and the environment it can implementation be successful. Most health programs, it can be divided into phases of implementation: pilot phase, control phase, actualization phase, operational phase. Pilot phase, whose development proceeds on a trial and error basis. Control phase, where a model of a particular program strategy is run under regulated conditions to judge its effectiveness. Actualization phase, where a model of a program strategy is subjected to realistic operating conditions. Operational phase, where the program is an ongoing part of the structure. Monitoring. Monitoring refers to the maintenance of an ongoing watch over activities of health service. The data typically collected for monitoring include input data, process data, output data. Input data, example, financial reports, transportation records, equipment and supplies purchased. Process data, example, specific activities carried out in completing the program, sequence in which they are carried out, and their timing. Output data, example, services are provided. Thank you.